Good morning and good afternoon, everybody. I see lots of folks still pouring in. We're going to give it another 30 seconds or so for everybody to arrive, and then we will get started. All right, let's jump in. We have a lot of people still joining us, but we will get the ball rolling. Good morning, good afternoon, wherever you may be joining us from. Thank you so much for being here. My name is Grace Rubenstein, Editorial and Communications Director with Health Begins. And we're really pleased to have you all here for our webinar on defending institutional integrity, about as timely a topic as I think we may ever have addressed on a webinar. So a few things you need to know before we begin. If we can have that next slide, please. So this webinar is being recorded, and you will receive a copy of that recording as well as slides by email after the webinar. So you don't have to rush and try to write down everything you hear. That record will be sent to you afterwards. Please also know that participant lines are on mute, but we really value having a lively conversation here. So if you have a question for us, you can enter it at any time into the chat window. And we've reserved plenty of time at the end of the webinar to have an interactive discussion based upon the questions that you send us. Let's actually just get that chat going right now with a little practice run. If you can find your chat icon on the bottom, open it up, and just send a note to the group with who you are and where you're joining us from. Here's a little demonstration from me. We would love to know who all we have with us in the room today. And again, that chat is going to be open throughout the hour for your questions, for your insights. And we do ask that everybody bring respect, curiosity, and joy into the conversation. You are absolutely welcome to share resources and insights there. We welcome those. Please note that we don't allow self-promotions to be posted in the chat. Next slide. Great. I love seeing all these folks. We have Somerville, Massachusetts, Michigan, Tuolumne, California, not so far from here, New Jersey. I saw Ontario, Colorado. It's wonderful to have so many people from so many places engaging on this subject. So our objectives today are that by the end of this hour, you'll be able to describe the latest updates and threats to institutional integrity and the connection of these events to health equity, that you'll be able to identify a range of resources and practices to help health professionals across all different levels of influence take action, and you'll be able to prioritize at least one concrete opportunity to use or a resource or practice that you may be able to implement from these insights. Next, please. So it is my honor to introduce our moderator for today, who will be setting up some essential background information before we begin and then introducing our panelists. I am happy to hand it over to Health Begins Managing Director, Salina Devaraja.
Thanks so much, Grace, and thanks everybody for joining us today. I agree, it is awesome to see the geographic diversity in the audience today. We're so glad you can join us. If you go to the next slide, just want to let folks know a little bit about Health Begins. We're hosting the webinar. We are a national mission-driven consulting firm and really a field catalyst and have been for over a decade. We help Medicaid serving health plans, health systems, and CBOs to really exceed any health equity and social needs requirements and look for a way to shift upstream conditions that heal and harm people to be able to achieve long-term impact for communities harmed by societal practices. You can see some of the reach that we've had in the infographic on the side, and we're really proud of the hundreds of courageous leaders and team members that we've helped move upstream, including folks on the call today. So thanks so much for joining us. We're going to kick it off to a poll, if that's all right with folks. Today we're talking about defending institutional integrity and hoping to share some resources and practices to protect health equity against current threats. So in that vein, if we can launch this poll, we want to better understand what threat is most material to your organization today. We know it might be tough for folks to pick one in a list, but we are asking for you to choose the biggest threat that you're feeling right now. And I see that folks are actively choosing among these. We have Medicaid cuts, organizational budget cuts. We've been seeing restrictions related to public health authority and expertise. There's litigation concerns related to health equity work, and certainly some chilling effects on health equity language, and other things that might not be on this list. And so if you select other, and if you feel comfortable, please share in chat. And I'm seeing a couple of folks talking about grant funding and the restrictions related to that. So thanks for calling that out, as well as organizational priorities. I'm seeing the hostile restrictions on effective interventions, so these health-related social needs interventions that we know work, and the restrictions related to that. So love all of these comments and ways that you're pulling up. So if we can stop the poll, about 80% of people have participated, and share the results. You can see what folks in this room are kind of experiencing in terms of threats most material to their organization. So the majority of folks here are experiencing the Medicaid cuts or eligibility requirements affecting their organizations. And the next kind of biggest threat seems to be the chilling effects on health equity language and programming, as well as a smattering of the others. Organizational budget cuts as well is at the top. So this tracks with what we've been hearing, and so appreciate you all for pulling that up. So we can stop sharing the poll. And if we could go to the next slide, we have one more kind of prompt for the audience before we kind of talk for a while. So in the chat, with all these ongoing threats, we are wondering, is there a health equity action or strategy that you are proud of, that your organization has taken, let's say in the last 3 months, the last 90 days, where you've seen it actually be constructive towards building community trust, whether that's the community you serve, the workforce community you're a part of, something that's brought you pride. So if you could put in chat just some of the glimmers, or maybe more than glimmers, really strategic directions that your organization has been a part of, enabled, led, that would be great. And love, Michelle, keep doing the work. Just keep it going. Keep it going. That's, I love that. Someone said that to me the other day, and it really hit at the right moment. So appreciate that. Love this collaboration point, working across departments. So I don't know if those are like new connections being built or reinforcing old connections, but love that connection. Lifting up others, lifting up partner organizations, leading town halls, engaging in storytelling. These are great. This is filling my cup, and I'm sure others seeing this, especially seeing the diversity of locations that you're all coming from into this space, and seeing the diversity of actions and strategies. This is great. And love some of the connection points. So if you're seeing something great and you're curious about it, please, call that person out, call that person in, and see if you can learn about it. I see some of that happening in chat too. So love that. If we can go to the next slide, and want to keep that energy throughout this webinar, just want to take a moment to name what's happening. I know folks see it pretty clearly because you're here with us today. But if you click through, what we know is happening is that the current administration is pursuing policies that erode democracy and concentrate power among a small elite. We know that this is something that's resembling either oligarchy or authoritarianism. It's a system that's going to benefit the wealthiest at the expense of most of the people that we serve. And a core strategy is to erode institutions. And that's why we're here today. And By institutions, we mean democratic institutions like courts, elections, rules of law. We mean administrative ones like public health or education. And we mean civil society, right? Unions, media, community organizations, and also hospitals and schools. These are all parts of these institutions. And we know that people make up these institutions. If you go to the next slide, what's being asked of us is to really promote and defend institutional integrity. And so for this webinar, the way that we're defining institutional integrity here is this component of trustworthiness, right? That the institution is able to carry the mission out fairly, which can be compromised by some of the actions that we're seeing from the federal level, that they're being carried out ethically, consistently, and that people who are engaged with that institution have confidence in the process and in the outcome. We're seeing that fraying. We know that institutional integrity also requires accountability, so that it's not that they've only earned this trust, but they're able to demonstrate answerability, that their decisions and actions are transparent, that they're reviewable, and that there are consequences if they fall short. So that's what we mean by institutional integrity. And we also use it in a way that recognizes, it's a little bit of a wordplay, but that it exists in opposition to institutional erosion. So it's not just only that we're talking about what makes an institution one that has integrity, but really that we're shoring up institutions so that they cannot be eroded. If you go to the next slide, we know this erosion is by design, kind of where I started. And it's this gradual weakening, hollowing out. This is part of what the design is. And what we're seeing is it's not just happening on the courts, it's not just happening in public health, right? It's now being brought down. The effects are intentionally now being enforced through hospitals, through schools. And that's also by design. But there's a role that we can think about and play to prevent that erosion by design from being carried out all the way through. And, the images here are just recent ones about ICE workers showing up in California hospitals. A number of institutions are really putting together well thought out plans to defend against that erosion of trustworthiness that is happening attendant to the raids. And I put a resource just on the slide here, and we can put it in the chat in a bit, from the California Academy of Family Physicians that really lists out detailed ways for institutions to respond in this moment. So we're seeing this erosion by design, and also, if you go to the next slide, the recognition that integrity matters for health equity, and organizations now coming in and leaning into that because we know that this trust requires public and community engagement. We know that when people lose faith in institutions, if they don't go to their healthcare settings because they're afraid of what may happen to them there or to their family there, they disengage. And when people disengage, they fall prey to disinformation and other kind of fear-based tactics. So institutions that continue to act proactively, fairly, transparently, and serve the common good can rebuild trust and reinforce democratic norms. And then institutions that fail to do so will ultimately lose the trust of the people they intend to serve and ultimately exacerbate health inequities. And so this will be like my concluding slide, which is like, why are we all here today? If you go to the next slide, we recognize that there's actions for leaders who are making up these institutions. And by leaders, we mean individuals at all levels. We've always meant that. Courageous leaders, it doesn't matter what your title is, there is a role that you can play. And so really recognizing your power and influence, regardless of your title, each of us holds that. And to understand what it is really crucial in this moment. To practice accountability and encourage others to practice accountability. This is both skill building and modeling. So building and enforcing systems where decisions are transparent, reviewable, and have consequences is important. The ability to understand risk and understand where you are able to absorb it, where you need to transfer it, where you can share it, is something that, we've talked about previously at Health Begins, and we'll continue to talk about. And then to collaborate across boundaries, I think of any audience, the audiences that show up for these webinars know how to do this really well, but really to name and lean into that interdependency of institutions and pull up on it in this moment. I just want to say we know that not every individual or organization will be able to act on any lever at every moment. Their threats are real. There are specific populations targeted. And so we don't want to undermine that reality. We still think it's important to think about each lever and think about where your role could be, and if not you, who in this moment. And so it's kind of with that I'm extremely thrilled to have the two leaders that we have on the call with us today, who've been playing these roles and also enabling others to play these roles in their organizations, as well as organizations that they collaborate with, partner with. And so our two guests today are Giridhar Malya, who's a senior policy officer at the Robert Wood Johnson Foundation, and Monica Soni, who's the chief medical officer from Khyber, California, as well as the chief deputy executive director of the Equity and Quality Transformation Division. I'm going to pull down the slide and really welcome Giridhar to go first and to share kind of what your organization is doing and the strategies that you're seeing at RWJF as well as partners.
All right. Thank you so much, Sadhana. The work that you and the Health Begins team are doing right now is just so important and timely and responsive to the needs of your partners and constituents all across the country. I know that I have personally benefited from it. So thank you for all that you're doing and for inviting us to join this conversation today. As Sadhana noted, I'm Giridhar Malya with the Robert Wood Johnson Foundation, and our mission as a health philanthropy is for health to not be a privilege just for some, but a right for all. And when I think about rights, or when people think about rights, I think they often think about the role of government, and that is an essential component of securing and maintaining rights for all of us. But rights really require collective action. In addition to government, it requires the efforts of civic organizations and everyday people in their communities, whether it's in their workplaces, their neighborhoods, or their places of worship. And that to me is why rights and having a rights framework is so inspiring and hopeful, even in times like this, that we all have a role to play and that we all help ensure that we can, each one of us can be healthy and thrive. So if we think about that right to health, one thing that's important for us as an organization is that our view of health has evolved over time. It's evolved from almost an exclusive focus on health care, which of course is essential, to encompass public health, to the social drivers of health, and then most recently to recognize and commit to action to address racism and other systems that deny people's inherent dignity and freedoms. So in a moment like this, and I think this really picks up on much of what Sadhana was talking about, we are trying not to draw too sharp lines around what's in and what's out in terms of the issues that are important for us as a health equity philanthropy right now. We are very much trying to see the interconnection between a number of issues. So the cynical attacks on diversity, equity, inclusion, the hollowing out of essential services like public health insurance and nutrition assistance, and even the militarization that we're seeing in cities across the country. And we think it's important to see all these things as part of a larger enterprise to both curb dissent and consolidate power. And I think that is the frame that we are trying to bring to this work in ways that are transparent, and accountable. So if that is our perspective or our intent with how we show up in the field and as a funder and an ally, I'm going to just share a few, three things that we are leaning into, especially in our work around defending racial equity, diversity, and inclusion, which I help to lead. The first is that we are really trying to speak out consistently and boldly about our values and our commitment to racial equity. And we're doing that for a couple reasons. The first is we are an institution with a tremendous amount of power and privilege. And we know that the vast majority of our grantees and field partners do not have that same power and privilege. So we are speaking both because it's important and it's about who we are, but also because we know that we can help provide cover for our organizational partners who are really on the front lines. These are the plaintiffs and lawyers that are challenging federal actions. These are organizers and activists who are standing up for the rights and freedoms of their neighbors and family members. And these are the people working in government who are trying to uphold their commitment to their professional duties and the Constitution. We know those are the people who are being truly courageous. So if we can help provide cover and space for them, that is the least of what we can do. Another reason that we are trying to speak out is because it is an opportunity for us to tell a more accurate and affirmative story about what racial equity actually is. And I think we can all agree that there is a tremendous amount of mis and disinformation about equity work. And it really is to chill the work, as Sadhana was talking about. So here we are trying to convey that equity work is not zero sum, that it can both address longstanding health gaps by race and other social factors, but also create better systems and better outcomes for people of all races. One of the ways we've done that is by putting out a piece that describes 7 examples of that in the healthcare system, where equity interventions lead to higher quality, more respectful, and more responsive care for everybody. And I'm going to ask that a link is dropped to that in the chat. The second thing we are doing is taking action to increase the size and strategic range of our investments as a funder. What I'll say is that we are near record payout, which means the amount of grant-making dollars we're putting out into the field. But I wish and I hope that we can do even more moving forward. There are some funders who have gone well beyond what we have gone as RWJF. And I think we are really looking at them as models for how we can do better on that. In terms of the strategic range of investments, we're doing a number of new things that we didn't do 5 years ago. I'll mention some of our work to resource legal advocacy at the intersection of civil rights, democratic freedoms, and health justice. This is work that includes challenging anti-DEI executive orders that are affecting every part of government. And many of our legal partners have been able to file cases sometimes within 24 hours of these federal policies being enacted. So these are folks who have been prepared for the types of really egregious actions we're seeing. And they've won in many cases, even if just temporarily, restoring grants related to diversity, equity, inclusion, defending programs to increase the number of women and underrepresented racial and ethnic minorities in healthcare and the skilled trades, and ensuring that hundreds of millions of dollars of education funding that was once curtailed is now getting back out into the field. You might be saying, well, we're seeing that the courts are another place where power is really being consolidated. And that's true. The courts in and of themselves are not going to save us. But even when we don't see wins, we are seeing lawsuits and legal advocacy as a way to slow down the federal policy machinery and to create space for others, for organizers and advocates and activists, to make the case for why these policies are harmful and why they should be reversed. So None of these strategies work in isolation, and I think that's a really important point to emphasize. Additionally, with this legal advocacy work, it's not just about litigation, it's also providing support to nonprofits who are doing essential racial equity work, but need legal guidance about whether their work continues to be lawful and how to design it so that it remains true to mission and has the impacts that they desire in the field, but prepares them to stand up to any legal scrutiny they may face. And one of our key partners there is the Lawyers Committee for Civil Rights Under Law, which has provided pro bono support to more than 100 nonprofit organizations across the country related to their racial equity work. And if we could drop a link to their pro bono services, that would be great. And then lastly, we as an institution are engaging in a truth repair and transformation process. And this is really about that principle of accountability that Sadhana was talking about. It is an opportunity for us to look at our past and to examine the ways that we have fallen short when we have not lived up to our values and where maybe we have caused harm to communities of color and other marginalized communities through our decision making or even our lack of action. So this process is looking at everything from our signature investments in things like healthcare coverage to how we have managed our endowment to our work in our home state of New Jersey. And I want to read a quote from one of my colleagues who's part of the memory and narrative team. She said that we are uncovering the stories that haven't been told that may present us in a less than positive light, but a more complete and authentic one. So this process includes looking at our history, diving into our archives, and working with a wisdom council that will really help us make sense of the findings and identify strategies for repair. This is going to also include a series of listening sessions all across the country to hear from people in directly impacted communities about what we found. And this isn't about casting blame, but it's really about building something fairer and more just together. As two of our Wisdom Council members said, there is no trust without truth. And the practice of recognizing harm and repairing relationships is central to all social change work. And that's really the spirit with which we're entering this process and continuing it. And we've already learned a ton. It has been uncomfortable, but that discomfort, I think, is essential for us to reflect, change, and be better moving forward. So I'm going to end there, Sadhana, and turn it back to you or turn it over to Monica.
Yeah, thank you so much, Gare. There's a lot for us to chew on. I just want to take a second to, invite folks to put any questions you have in chat for our panelists as we go along, and we'll have time at the end, as Grace mentioned, to address them. And with that, I'll turn it over to you, Monica.
Thank you. Thanks so much. And good to be with everybody today. I see some friends on, so I know I'm in good company. As mentioned, I'm Monica Soni. I'm a practicing primary care doctor and the chief medical officer of Covered California. We're California's state-based marketplace and support nearly 2 million folks across the state in high quality, affordable coverage. And we're an active purchaser. So we negotiate pricing and we have contractual requirements to ensure that there's value from that coverage and that there's both quality and equitable outcomes. For context, we are a government department, and we do report to a board, and our board chair is the Secretary of Health and Human Services for the state. So just to contextualize, right, there are some things that are more challenging for us to do as compared to potentially a philanthropy organization. And I want to talk about even within those constraints and confines, what I feel really proud of that we're doing. The first thing is I can't undersell this, and I know how challenging it is in this moment, but it is the leadership. We took a look, right? We reviewed and reaffirmed our mission and our vision, which is to improve the health of all Californians. That is a very broad vision. And from the beginning of Covered California's creation, in the mission statement back, over a decade ago, it said to reduce health disparities. And so reaffirming that in this moment has been really critical. And then my boss, Jessica Altman, frankly, like when I'm facing hard decisions or I am worried about a path that I would like to take forward, her counsel to me is to do what's right. And I cannot tell you how amazing it is to have your boss say to you, do what's right. So that I'll just, I'll start with that. I think the next part you mentioned this, Sadhana, is to understand your sphere of influence and your organizational strengths. And we are able to do some things because we have this board. We're a semi-independent state department. My boss is in DC for the second time this week, I'm pretty sure, right? Talking about what we do, talking about our people, talking about the impacts of some of the policies that have already landed or that are still to come. And we have an amazing team inside that runs pretty advanced technical assistance, right? Like we don't lobby, we don't technically do advocacy, but we can give really crisp technical assistance. So, the team will run data on the impacts of these policy changes. There are white papers and member stories that are collated, pulled together, are slick, are run by congressional districts so that folks can just pull and use them as needed. And so we can drop the link to some of those which are publicly available and posted that stratifies by older adults, by rural communities, by communities of color. And frankly, even some of our health plan leaders, like, right, a Kaiser leader said to me, oh, hey, those are really useful for us when we do go to DC to make the case. And so making sure that that's just publicly available. The next one is we have all claims from all of our health plans. We are the only state-based marketplace to have that. CMS has it, and then we have it. So that is a very important place of power, as mentioned earlier. So when something might come out, a data release or what it might be, like we could run those parallel analytics and potentially provide some nuance to the rhetoric or the narrative that might be happening publicly. Again, that's technical assistance. It's just sharing what we happen to know from our own data set. The next category I would say is trying not to squander any opportunities that are presented. And for me, if it has to do with the health of Californians, I think that's my job. So I have a very, very wide lane, is how I interpret it. And I'm always hopeful that some of the formal channels that exist, that there's somebody, right, who will read my comments, that there is somebody who, when they put out a request, actually cares about what our lived experience is here in the state. And so, we've responded to at least 5 to 6 federal comment opportunities on everything from quality measurement to data transparency files to fee schedules, right? Like trying to make sure that our voice is there along with others. And I'll say that right now, there is a current call for members for a federal health advisory council. You can apply right now. You can self-nominate or your organization can nominate, and I'll put that in the chat. Because how powerful would it be if the 297 participants who are on right now all nominated, right, from our perspective and our vantage point? Like maybe none of us will get chosen, but I do think we've got to use the opportunities that are presented in front of us. So I think that's another critical part for me that helps me get out of bed and do the work every day. The transferring of risk is really important. So how do we support others that either aren't able to be public in those same ways or who don't have the resources and capacity, but can be in alignment with us? So when we do write some of those public letters, we've done some across 3 states, right? Oregon, Washington, and California for the first time publicly responded to some CMS comments around some of their quality programming. And the California public purchasers, meaning DHCS, Medi-Cal, Covered California, and CalPERS, who supports public employees, consistently write things together and submit together. So whoever has capacity or bandwidth in the moment, or maybe that expertise can take the lead, but we all come along together. And the 3 of us represent over 45% of all Californians, right? That's an enormous amount of sort of market power when we put ourselves together. And then the other part is, whatever resources that there might be, thinking about how to use them in new ways. And I will say, this is where Assad and I really got to work closely together, but we had opportunity to redirect funds from underperforming health plans through one of our quality accountability programs that ended up totaling $15 million. And maybe rather than do some of the traditional things that folks have done in maybe the state space, we took it to the people, right? We cold called our members, we surveyed our members, we created an advisory council with our a current California enrollee amongst the others to help us think about how should we use those funds. And what ended up getting funded for 2025 and is in flight right now is one, it's a card with cash on it to fund groceries, no restrictions on if it's, quote unquote, healthy food. We know that the levels of food insecurity in our population are substantial and potentially going to get worse. And so that to us was a direct connection to health needs and very squarely in our mission. So that's one. So we've got, 13,000 folks that are now getting support for food acquisition. We're funding child savings accounts for all of our babies, our kids who are 2 and under, because we talk about getting upstream, thinking about educational attainment and the opportunities there, we know is really a linear path to health and outcomes and financial mobility too. So like we're taking the money and it's going into their child savings accounts, and then funding small independent primary care practices that are on the ground doing a lot of this work. So again, like this was a unique opportunity and we decided to push. Lots of legal oversight on what we were trying to do here, lots of gray, but we decided to sort of take that risk on in that moment. And then I'll maybe just close with this, which is I personally have had to find my bravery, right? I'm a Black and South Asian woman at California's Obamacare, running the Health Equity and Quality Transformation Division. I look like how I look. People are getting killed for their ideology right now. So, talking to my husband, having a conversation about our comfort level with being more public and more vocal, and is our household okay with that when we have 2 small children? And his, resounding yes, that like, if you're going to be in this seat at this time in this moment, like maximally use it, I think has given me a lot of, has bolstered my bravery in this moment. So I know that's hard for all of us to do at times like these.
Thank you so much, Monica, and also for sharing your personal story there and for your bravery. And just to stay with that point just a little bit longer, that bolstering is so important, and so glad you have that in your family and in your leadership at your organization, and really think that's one of the roles that we can play for each other in a number of the circles that we're in. So appreciate that. Thank you. I'd like to invite both Gerda and Monica. Thank you both for your opening comments here. We're going to pull some questions from the chat that have been coming in, as well as some that we thought of before. Please keep putting your questions in the chat for us to ask the panelists. We have about 10-ish minutes where we can chat together, maybe a little closer to 15. So I think maybe where we'll start is with that example of leaders that are doing what's right and sticking with leadership. So Monica, you shared do what's right as an example. You need to get that on a shirt and wear that, I think, and give it to everybody on this webinar. But also curious, there's kind of the spectrum of folks that have that certainty, leaders who have that certainty, that as an example of what, kind of they're doing right. There are others that are intentionally not doing what's right, maybe by our standards. Do either of you have reflections on things that are in that gray area? Like, are there things that leaders are doing that are unintentionally eroding trust that they're not recognizing? So kind of naming, are there things that leaders should stop doing that are unintentionally eroding trust?
I'm glad to hypothesize in this space. One, I think, is sometimes, well, obviously there's a lot of uncertainty. Every day we're uncertain about what else is coming or how things might land. And so I think sometimes we choose to be silent in that moment, like, oh, well, we'll see where it lands, or that's active litigation. I think that's a very scary place to leave people who have no idea if you're going right or left or up or down. And so I actually think that silence is really damaging. Even coming forward to say, here's what we know, here are the type of conversations we're having internally, and we're not sure yet, I think gives people a lot more trust and is critical in this moment, especially as we've got a long road ahead of mounting uncertainties.
I love that reflection.
Yeah, I'll just build on what Monica shared in terms of speaking out. with the militarization of DC, there was a very quick and I think definitive conversation internally that if we care about equity and justice and the health and safety of communities, we need to be speaking about that too. And to help people draw the connections between what's happening there and what's happening to health programs, whether it's Medicaid or community health centers. And I think one thing that we can all do is help people connect the dots between these issues. Um, we can't assume that people are seeing actions in one part of society as very closely related to what's happening elsewhere. And I think just to put a fine point on it, we saw in the latest budget bill that was passed by Congress that as $1 trillion was cut from the Medicaid and SNAP programs, most of that trillion was put into tax cuts for wealthy corporations and billionaires, and 150 billion new dollars into immigration enforcement to truly militarize immigration enforcement. And I don't think this is an exaggeration to create a paramilitary-like force that is not loyal to the Constitution and to the usual norms of even within the military, but to a person and to an ideology. So those are decisions that we are making about the best use of public dollars. I think there's a very important counter story to tell that if we really care about safety and security, we could be investing those dollars into communities, into affordable housing, into community violence prevention programming, into the greening of parks and recreation centers, into the people that live in and love these communities every day. So that is really important for people to understand that we're making decisions right now about what we value through what we invest in.
Thank you, Gary. That's such an important point that both of you made. Really, the two sides of the same coin of naming things for what they are, both by connecting the dots with what's happening federally or at the state level or local level with the investments and kind of where values are, as well as naming things for what they are for your organization publicly and with your, or at least public with your staff is what I'm hearing, and appropriately with others, so that folks have that trust that you're seeing things for what it is and also making reasonable choices. I think especially with what you ended on, Garadar, that one of the interesting points for me is that, you know, this has been the case for all of our history, right? Like our investments are our values as a nation. And so we do see this as an opportunity moment where people are kind of better seeing those dots connected and have more engagement to lean into that. So at Health Begins, we have our Health Equity Policy Hub that's generously funded in part by the Robert Wood Johnson Foundation. But that's part of the work that we're trying to do, is helping health equity leaders connect those dots and find their role in it and not cede that territory to legal counsel who may or may not see it the same way, or compliance officers who may or may not see it the same way, and use your health equity lens in this moment to be able to connect those dots and speak forcefully about it. So I appreciate that.
Can I just make another really quick point? I think just to talk a little bit about risk, I think this is, and Monica alluded to this as well, I think this is a incredibly important opportunity to reassess how institutions assess risk. It's almost always about downside risks to the organization of acting, but we really need to think about the risks of not acting, the risk to our mission, the risk to people seeing our institutions as trustworthy and accountable, and the risks to our partners in the field who are truly on the front lines and taking the most courageous actions. Philanthropy has a huge problem with that, but that is something we've been actively working on to shift the risk conversations away from us towards the people and the communities that we are partnering with and have the most to gain or lose.
I love that point, Gary. I have maybe a follow-up on that, because both of you spoke about absorbing risks, transferring risks, sharing risks in different ways. And so for folks on the call, and also I saw it in chat from people who are listening in, wondering, how do you go about identifying risks that can be absorbed or transferred or shared? So even in the situation where you reached out to other states and commented together, that's a shared risk strategy. Gary, I know you spoke of numerous examples. Could you talk through kind of how that comes about in a concrete way?
Yeah, I'm glad to start for us. I mean, I think I know not everyone has the same situation, but we really are lucky to have a leadership team that wants to talk openly and honestly about it and is happy to air it. And then I think we have a lot of trusted folks around us, right? We can take something to our board, we can take it to our consumer advocates. Our board meetings, you sort of talked about where we talk about uncertainty. We talk about it publicly. Every board meeting, there's an update on federal state changes so that there can be public dialogue about what folks expect Covered California to do and where they want us to push further. And so when we have our internal conversation, there's already the voice of the public and public expectation helping us mitigate this idea of, is it riskier to act or not to act? I'll give a concrete example. The federal subsidies, which help support folks get affordable care on new marketplaces, expires in December. It has not been renewed yet. And so we're approaching open enrollment. We see on average that the increase in premiums is 93%. 93% increase from what is currently happening to what will happen in 2026. And actually, it's over 100% for communities of color. So also, right, disproportionately impacting our folks. The subsidies could be extended, lots of uncertainty. We talked about it internally and said the risk of not saying something to folks about that is worse than the risk of saying something. There are folks that need to start saving if they're going to be able to continue to get coverage for things that they need, their active cancer treatments, their chronic conditions. And so we just made a choice. We're going to start sending out messages alerting folks to the fact that we have not had action yet federally. And this is what we're sort of seeing in terms of potential impact to folks, to the 2 million people that we support, right? Like that was this moment where, again, act, not act. And we just had to be honest about it. And I think and we consulted, of course, again, with our consumer advocates and others. And the push was, you know what? Yeah, like we just have to try to get in front of it or be open with folks about that.
Thanks, Monica. And I know, Gerda, you had also kind of talked about this action, inaction, cost of inaction kind of scenario and kind of planning. So wondering if there's anything you would add to kind of that absorption, transfer, or shared risk assessment that you're doing.
Yeah, two quick things in terms of equity work and the retreat that we've seen, and there are a number of comments about this in the chat. Some of it has been anticipatory, unnecessary compliance. And I think that is a fair way to characterize it, while at the same time recognizing that there is just a historic amount of bullying that is happening of institutions, whether it's higher ed or nonprofits. So people are fearful for good reason. So I think in balancing those things, one of the things we're doing is saying, hey, let us and our partners really help you understand what the legal risks are and aren't around equity work. Very big picture, most diversity, equity, inclusion work remains lawful. The underlying law has not changed. Yes, the orientation of the federal administration has changed. Yes, there is a trend in court decisions that is more hostile to equity work, but most equity work remains lawful, and we're trying to help folks understand that. It's really the race-based initiatives that provide specific benefits or supports to people of a specific racial or ethnic group. Those are the ones that are going to be most prone to legal challenge. There are still instances in which you can do them. And what's very important is to be able to document clearly specific instances of discrimination that have led to harms. That's often what is happening in these statewide reparations initiatives, where they are taking significant amount of time to publish 500-page reports like we've seen in California and New Jersey. meticulously documenting the harm of racial discrimination from the time of slavery all the way up through the present day, to make a case and to create a historical record for why race-based actions, race-based repair are needed. So there's still ways even to do that type of work, but most of the DEI work that people are doing is not that. Therefore, it can continue by and large in the same ways that people have designed it. So that's I think one important thing that we're doing. And then providing our field partners flexible long-term support so that they can think not only about their strategic goals, but also about their organizational needs, whether it's digital security, whether it's access to legal counsel, or whether it's something else. So those are two things that come to mind.
Thank you so much. And I think we have time for one or two more questions. One question that's come in is, have any of the panelists had to reframe language, job titles or names, thinking about the poll at the beginning where this was one of the major concerns of the group here, or, in the case of RWJF, maybe partner organizations have had to do that to mitigate potential loss of funding. And do you have guidance for those who are gathered today on that point and kind of that real risk that you mentioned?
Yeah, I mean, I think the previous comments were exactly right. We read very carefully the executive order and thought a lot about which parts apply and don't apply. And to that point, much of it didn't apply for our specific organization. And so I'll just say internally for us, there has not been a change, but we as an example require all of our health plans to get health equity accreditation through a national quality organization. And they are revisiting this because they are a federal contractor. And so I think we're trying to be thoughtful partners to that, right? We're trying not to finger wag at folks that do have those constraints and challenges, but also not lose what the work really is, right? Because I think it is this slippery slope. And I do sometimes worry with some of what gets substituted in, on the ground, are we still advancing the areas where we know there are the biggest gaps? Are we still supporting our, most marginalized communities or not? And so just as an example, we responded to the NCQA public comments, again, in partnership with others, and we're very specific. Fine, you don't think you can say that anymore, but here are the things we want to make sure that we do see that you're continuing to do programmatically that are not illegal. Here's the evidence base around why racial concordance in clinical relationships makes a difference on mortality, right? And pulling those citations forward. So it's things like that, right? It's not relying on just the language, it's underneath it. Do we still have what we need, and trying to be extremely, extremely explicit about that?
So much, Monica.
Yeah, I think leading from a place of mission and what are your goals as an organization is essential. And we too have been very cognizant of the fact that the risks that we face are, as a private philanthropy, are often significantly less than those of our partners, and have been respectful of changes that they feel like they have had to make. But what we've tried to say is, one, we want to provide you guidance and resources so you can make those decisions in an informed way. Two, if you need, for example, additional legal advice that comes from outside of your institution that might be able to provide a slightly different perspective and maybe deeper expertise in civil rights law, we want to make that available to you. I think we've maybe been taken the strongest line with folks in philanthropy because one, the power and privilege that we have that many of our field partners don't, but two, the additional protections that we have to have our spending, our investments, our grants be protected by the First Amendment. So I think it's with peer philanthropies that we've said there is very little to no reason that we need to be changing language, that we need to be pulling back on programs, that we need to be reducing investments in racial equity work. And that's work that we've done with the Association of Black Foundation Executives and others in the field to say that, no, this is a moment to actually double double down on that type of work.
Thank you, Gira, there. And what I'm hearing from both of you is really this kind of imperative to dig in and do research, right? Like understand what the language is saying is legal or not legal. Build the evidence base or find the evidence base that protects the work that you're doing to fight for it. If you can't build it, then I know in the kind of previous section, Monica, when you were talking about the data that you are able to collect and how you're able to share that, find the organizations that can do that. To Gerard's point, the legal teams that have this historical expertise in civil rights law. So it's really calling of us this like critical research ability, this problem solving ability that I know the upstreamists in the room all have, and drawing on that ability to read critically and then build those bridges to build the evidence base for the case that you need to make. So love those points that you both raised. I'm going to try to squeeze one question in here. And this might also be a final word for both of you before I turn it back to Grace, just about kind of how you're feeling. Optimism, pessimism. I think the actual question involves a crystal ball of sorts of when will this stop? But kind of how, what is bringing you optimism? I'm sure there are things bringing you some pessimism, but as we close out here.
I'm actually generally an optimist. That is my predisposition. I was a cheerleader in high school, so like pulling on all of that. Here's what I think I have been feeling like I haven't been doing a good job of, and I wonder how many folks already have this, and I just haven't. But I mean, we don't love the systems that have been in place either, right? We've been calling for change too. Have our toolkits been crisp enough, right? Like, I was talking to my cousin who sort of was like, it's like burn it to the ground. And I was like, okay, but what will we rebuild that actually meets everyone's needs in the ways that we want it to happen? And I've been thinking a lot about that, right? Like, is it lowering salt content in foods? Since that's that's where you have the most cardiovascular risk and Americans are dying from, right? Was that on my toolkit before? No, it wasn't. That wasn't something that I was pushing forward. So there are things like that that I want to have a little bit more packaged and out in the world so that if and when the opportunity comes for us to rebuild, we're actually ready. So that maybe is giving me a little bit of forward drive.
Thanks, Monica. You're there.
Yeah, I love what Monica shared. Maybe two things. One, just being able to rely on people that love me and care about me personally. My sister, who's a lawyer, the other day said, make sure, along with your passport, that you carry my card around with you wherever you go. And I was a little shocked that she said that. But I knew it was coming from a place of love and care. She's an older sister. She will always be an older sister, and I love her for that. I think for all of us to be able to remember who we are loved by and whom we love, and have that be at the center of our work, and to be able to see everybody as human and as having inherent dignity, that brings me tremendous hope. And then when you apply that to policy issues, there are still so many things that the vast majority of Americans agree in and want to see. Affordable, respectful healthcare, a robust Medicaid program that has the resources it needs, increases in the minimum wage, even something like childhood vaccinations. We're still around 92% of kids having the full suite of recommended childhood vaccinations. Are things changing in some seriously concerning ways, and are they likely going to get worse? Yes. But there are so many areas where where people in this country have shared preferences and shared values. And I think those are the things that I need to keep reminding myself, and that we need to keep reminding ourselves as we do this work.
Thank you so much to both of you. I love those kind of moments, and also Monica, the cheerleader thing tracks. So really pulling on, the people closest to us. Gareth, that was a beautiful story you shared about your sister. So thankful for her as well as for Monica's husband. You really both brought that point in of how we need to look closest to us to draw our strength, while we imagine and reimagine a future that all of us can thrive in. So appreciative to both of you for engaging in this conversation. Hope you're seeing all of the love that was in the chat as you were speaking, as well as the conclusion of this. Grateful for your leadership and insights. And with that, I'm going to turn it back over to Grace. Thanks, everyone.
Thank you. And just speaking for myself, some of those personal notes really resonated most deeply of all. So if we could pull, we have our slide. Thank you, Bobby. So just to wrap, and some housekeeping notes that will be helpful to you. Thank you so much for joining and for that really thoughtful conversation in the chat. So we will be sending out a recording of this webinar along with some key links and the links that you saw dropped in the chat. Look to your email for that to come within the next day. At the end of the webinar, you're going to see a survey pop up on your screen. We really appreciate it if you fill that out so we can make our next webinar just as helpful to you. And this is clearly an ongoing conversation. There's so much more to say. Let's continue that both on Blue Sky and LinkedIn, as well as in future webinars. And thank you so much. We'll see you again soon. We're in this together.